I'm in the healthcare system for 35 years, and I feel since the death of Joyce, people are more aware, people want to do something.
5 years since the September 28, 2020 death of Joyce Echaquan, an Atikamekw mother of 7 who died at a Quebec hospital in Joliette, north of Montreal, where just moments before her death, she live-streamed as hospital staff hurled derogatory and racist remarks at her. Dr. Stanley Volant, an Innu surgeon based in Montreal, says he's seeing progress when it comes to cultural safety of the Indigenous population accessing the healthcare network.
Her death made the changes to happen. I would have preferred that Joyce is still with us today, with her 7 children. But I see changes are done.
Dr. Volant is the Chief Medical Officer for the First Nations of Quebec and Labrador Health and Social Services Commission and also sits on the Board of Directors for Santé Québec. He says he's seen healthcare workers become more sensitized to Indigenous health with changes he's never seen before implemented at the Chicoutimi Hospital 5 hours north of Montreal.
When I entered the emergency, there was a sign in Atikamekw and also another sign in Innu, explaining what are the processes to make a complaint or to ask somebody to accompany the people.
Last December, Quebec passed Bill 32 requiring health and social services to adopt a more safe, welcoming and inclusive approach when interacting with Indigenous people, including mandatory training on Indigenous cultural and historical realities.
This is the first step. It's not the perfect step. It was maybe not done in co-construction with First Indigenous people, but I think it is the first step that we have to do, and we have to do other steps after that.
Yet Dr. Volant says many are still reluctant.
People doesn't trust the healthcare system. They are afraid of the healthcare system, that they won't be treated equally than the rest of the population. They are afraid of consequences. If I complain, maybe I won't have the healthcare I need. So there's a lot of training to do, learning to be able to give the good health care.
Dr. Volant says remembering how and why Joyce Echaquan died is equally important in the path to moving forward and making sure racism and discrimination aren't present in healthcare.
What I saw for the last 5 years make me optimistic. But we have to be careful and to continue in that path and to don't stop. If we stop today, we will miss the boat.
In Montreal, Alyssia Rubertucci, City News.